everybody, and welcome to this Meet the Faculty podcast dedicated to the second Davidson Mestman intensive course in diabetes, endocrinology, and cardiometabolic disease. And it's my pleasure and my honor to welcome Dr. Philipp Scherer today. And how are you, Doctor?
I'm fine, thank you.
So let's start, Doctor, with just can you introduce yourself? Maybe tell us a little bit about your background and research journey.
Oh, absolutely. Name is Phil Scherer. I'm the director of the Touchstone Diabetes Center at UT Southwestern Medical Center in Dallas, Texas. I've been here for roughly 20 years. And prior to that, I was for 10 years in New York at Albert Einstein College of Medicine, did my postdoc in Boston, and basically going all the way back, grew up in Switzerland and got my basic education in Switzerland.
Oh, amazing. Thank you so much, Doctor. So tell us a bit about your discovery of adenoponectin and how it completely changed the way we understand adipose tissue and metabolism. So looking back, did you realize at the time how transformative this finding will become?
Well, of course, you never know at the time, and it really takes a lot of time for things to settle in, basically. But if we go back now 30 years, it's literally been 30 years that the field in general, we specifically became interested in adipose tissue as an endocrine organ, releasing all kinds of things. This was the time when the Friedman lab reported leptin, we reported adiponectin, and that really set the stage for a higher level of appreciation that our fat tissue is not just an inert storage organ for triglycerides, but it's actually an endocrine organ. And I think that's been extensively worked on over the past 30 years. And we are where we are right now. We have an increased appreciation for the tissue and its role in the bigger picture of cardiometabolic renal syndrome in the system.
Okay, fantastic. And so today we talk so much about the relationship between obesity, diabetes, inflammation, cardiovascular disease, and metabolism. From your perspective, how interconnected are these systems?
I think if we've learned one thing over the recent past in particular, but actually over the history of sort of endocrinology in general, that inter-organ crosstalk is essential and plays an essential role. Our liver talks to the fat talks to the heart talks to the kidney. We appreciate all of that. And I think it became clearer even now with the weight loss drugs available out there that the fat tissue is sort of a central player in the big scheme of things, because in order to benefit of the quote unquote side effects of these incretin drugs that include effects on the heart, the kidney, the liver, we really need to lose weight. That's the condition. Weight loss is an integral part of that. And that really puts, of course, fat tissue center stage for the whole process.
Fantastic. So amazing that you will be joining us in this second edition of the Davidson Mestman course. What are you most looking forward to share, or discuss with the attendees in December?
I'm very much looking forward to the meeting. This has been obviously a highlight over decades now in the field, particularly with reaching out to the Spanish-speaking colleagues, basically. But now we are venturing into a little bit of a sliver of English as well, and I'm really privileged to be part of that and share some of the hopefully most recent insights in terms of what a clinician should know in the context of a better understanding of our adipose tissue and its contribution to overall metabolic health. I will be talking about insulin sensitivity. I will be talking about inflammation. I will be talking about fibrosis as well. That's kind of one of the key messages that I'll try to bring across, the fibrotic response in the whole system, as well as within adipose tissue, which will help us understand how some of the widely used drugs that we have out there work or maybe don't work in that particular area.
Fantastic, doctor. And finally, what message will you give to young physicians or specialists entering the field of diabetes, endocrinology, and cardiometabolic research today?
So I believe we are right now, and I'm speaking now with this year, last year, the last 2 or 3 years, really in the most exciting phase, basically, during my lifetime in the areas of endocrinology and cardiovascular disease, where we really start to gain a better understanding for what is going on at the individual organ levels and how these things talk to each other. So as a result, I think it is an exciting time to enter the field to tackle some of these critical questions, and having the type of technology at our fingertips that we currently have, we really are making huge progress in our understanding of the disease and how to effectively intervene at the individual patient level in a personalized, perhaps, way of approaching that particular patient's history and overall condition to improve the overall metabolic state.
Fantastic. Well, thank you so much again, doctor. Well, we hope to see you and meet you in person. And yes, this is an invitation to everybody who's watching. It's a CME accredited course, and just don't miss it. We will be welcoming everybody on the 11th and 12th of December in the Hilton Aventura in Miami. Thank you, doctor.
Thank you. See you all in Miami.